Fever. To talk about the fever, and simply when the fever comes, the heat comes to our mind. So it is just the excited state, and many a time we feel excited. And with the excitement, the temperature goes on. So there is and temperatures keep fluctuating. And with this, there are so many understanding about the fever and misunderstanding about the fever. So between this understanding and misunderstandings, there are the things that we consider the fever matter and sometimes also to be the very serious matter. So between the seriousness and the simplicity, that is the simplicity and the complexity, we have to understand what is the fever and why it comes and why it is there. So right from the beginning of we started thing that we experience, the human beings have experienced were the fever. And with this fever, lot of the learning has come up. In spite of all those learning, the fever still remains a very controversial subject for all of us. And it is also sometimes very difficult to treat and sometimes very simple to treat. So many a patient, many a doctor complains that treating a fever is a very most of the difficult time situations, and sometimes it seems to be very simple. So with this thing understanding, with this background, let us see what is fever, how it can be handled, and I am going to demonstrate in some of the cases also. Friends, fever is perhaps the most ancient hallmark of disease. It dates back as far as civilization itself. Right from the birth of the civilization, right? The day we started learning about ourselves, our experiences, gaining experiences, fever is associated with our learning. And that because whatever we do, whatever type of the things are there are change in the temperature of our body. The heat situations do not remain same every time. Sometimes it raises to high and sometimes it goes down to low. So fever is as being induced by evil spirits. In the ancient time, it was felt that fever is because of some of the bad omens, some of the ghosts, some of the evils that the spirits they are putting on the curse on our life. The oldest civilizations, Egyptians, Mesopotamian, Chinese, Indian, and Greek, demonstrated extensive knowledge of the anatomy, physiology, but they tended to view fever as being induced by the evil spirits. And still today, we many a time and many of the fever types like the smallpox and many of the other diseases are considered as the evil spirits, and they satisfy or pacify the spirit so that it can be cured. And this tradition is still being followed nowadays. History reflects that fever was feared by ordinary people as a manifestation of punishment. Why fear comes? Because we are being punished for our bad deeds. However, for medical scholars, the biological role of fever in disease was considered as beneficial, particularly. Now, these are the beliefs of the society, of the civilizations, of the common man. But the historian, the medical persons, and the biologists, they feel that the fever is beneficial. It is not bad. It is good for our life. It has to come, and whenever fever comes, our body gets purified by burning all the heats that had accumulated in the body. This concept underwent a radical transformation in the 19th century, and scholars began to regard fever as harmful. And then again, it was beneficial, and later on, some of the harmful effects were the fever was noticed because of the malaria, because of the typhoid, and because of so many new diseases that were discovered, that where the fever seems to be the fatal, it was also regarded as the harmful. So from beneficial to the harmful effects, the concept remained changing. The use of antipyretics was considered beneficial. So people started thinking about having an antipyretic medicine, anti-fever medicine, so that the fever can be controlled. And with this, in the 20th century, the fever therapy were introduced. So from the evil spirit or the marker of the death, this was the marker. This was the evil spirit. That means now the death has to start. This was the thought. Then it was understood. The scholars and the biologists understood that it is also. Thereafter, the people found harmful effects of the and the concept kept changing from harmful, evil, or to beneficial. And what concepts over the investigate the role of so still there is evidence now indicates that the effects of fever are complex but overall beneficial. We get the fever, the effects may be harmful to some extent, but it has been understood of late that it is overall beneficial. After having fever, the immunity power of the body gets increased. So with the fever, what we have? We have everything. It is not alone. It is everything. We have the headache, we have the body ache, we have the sore throat, we have the cough, running nose, diarrhea, and whatnot. Everything gets associated. So in the central point, it is the fever. The central point is the heat, and heat is creating so many effects are there. So it is important understanding that we have to keep why the fever. Why the people were fearing about the fever? Because fever invites so many problems. Not one problem, the multiple problems. It can bring any other concomitant symptoms along with it. And it is useful information for our treatment purpose also that we must understand what things are concomitant with the fever. And with changing concepts in the 19th century, part of symptoms complex as it is today. A disease is in its own example of fever being regarded as a disease where autumnal disease, jail fever, hospital fever, so many new fevers came up. Fever could also be described in the term of severity in the disease, of the disease. For example, malignant fever or pestilential fever, or even the term of the supposed pathology of the fever, bilious fever, nervous fever, and so many fevers. We get nervous, we get excited when the jam fever is there, and so many type of the fevers that come up. Anxiety fever, fever because of the fear, so many fevers are there. It is like that. So nowadays, antipyretics are among the most used drugs worldwide. Antipyretics, Dola, so many names you may have. The changing pattern in the concept, despite their widespread use and popularity, question arises: how beneficial the fever is still? The most important question is how beneficial is the fever? Breakthrough in the fever concept came with the science of bacteriology. The milestone in the changing concepts of the fever, it was able to with the bacteriology, the introductions of people know bacteria, the discovery of the microscope, and with the discovery of the microscope, we came to know about the bacteria, and later on with the viruses also. It was also able to reveal the etiology of many infectious diseases, such as the identifications of the typhoid bacillus in 1880 and the discovery of the tubercular bacillus in 1882. Fundamentals of thermoregulations and the role played by exogenous and endogenous pyrogens in the inductions of the fever. So there are the thermoregulations. The body has to maintain a minimum temperature that we all have 98, 97 degrees Fahrenheit. Body temperature was regulated in healthy organisms by the balancing of heat productions and loss. Two things keep on going on. the heat is being generated and it was demonstrated that animal died quickly when the body temperature exceeds the normal level of 5 to 6 degrees Celsius. Thus, suggesting that fever may be harmful and that antipyretics which were introduced later on may be beneficial. The William Osler, father of the modern medicine, declared that the humanity has three enemies. He has declared he is the father of the modern medicine. The humanity has got three enemies: fever, famine, and the war. But fever is by far the greatest. So among the three enemies, the fever, famine, and the war, the fever is on the top. Fever is among the most common complaints and cause of seeking medical attention. I think we all practitioners have fever, some cases of the fever in clinic every day. So the biological value of fever, whether it is beneficial or harmful, is a matter of dispute. And fever is being treated with the belief that this may prevent complications. Fever is harmful. This is the argument for the fever being harmful and may bring about discomfort, dehydration, febrile convulsions, brain damage, and death. Antipyretics are preferred method of managing fever, and there has been increase in this preference over the past 2 decades from 67% to more than 90%. So fever is harmful, this like that, because it can bring discomfort, it brings dehydration, because it brings high fever, convulsions is there, brain damage may happen, death may happen, so fever is harmful. The risk of febrile seizures fever can cause the benign convulsions in 3 to 4% of all children. In a study from the USA, 49% of the pediatricians considered convulsions to be a principal danger of fever, and 22 believe that brain damage could result from fever, febrile situations, and that antipyretic measures should be administered to prevent fever conditions and other complications of the fever. So, because of the harmful effect, the side effect, the effect that can have, the fever was considered to be the harmful. Now, there are also concepts that the fever is good, fever is beneficial, because the fever is self-limiting and self-controlled, and with the fever, unlike hypothermia, body temperature is well regulated by a hypothalamic set point that balances heat production and hot loss of so effectively that the temperature will not climb up relentlessly and does not exceed the upper limit of 42 degrees Celsius. Within this upper limit range, 40 to 42 degrees Celsius fever is not injurious to health. Now, antipyretics do not prevent fever. There is also now abundant evidence against the previously assumed risk of fever. It is also known that antipyretics are ineffective in the prevention of the fever. The effect of fever on microorganisms animals studies have demonstrated that gram-negative bacteria such as Salmonella typhi were shown to be increasingly susceptible to the antibacterial effect of serum when cultivated at a temperature of 37 degrees Celsius. Fever has therefore a favorable and prognostic influence of the length of the bacteria on the length of the bacteria excretions. Why fever is there? Because fever can eliminate the bacteria. Fever can remove the poisonous substance, the toxicity of the created by the bacteria. So fever is good. The effect of elevated temperature on defense is like a defense mechanism. It is a protective measure. Fever may act synergistically with antibiotic. Penicillin was found to have a progressive increase of its bactericidal activity as the temperature rose from 35 to 41.5 degrees Celsius. The hygiene theory says that prevalence of asthma and allergic disease as well as the cancer has increased worldwide for many years, and the hygiene theory has been offered to explain the rise. Over last 40 to 50 years, intensive research has been carried out to investigate the role of fever. There is evidence now indicates that the effects of fever are complex but overall beneficial. Accumulated data from extensive research suggests that fever has a protective role in promoting host functions against infections rather than being a passive byproduct. There is evidence that if fever exerts an overall adverse effect on the growth of bacteria and some tumor as well as on replications of the viruses. It also enhances immunological processes, although scientific evidence does not support this practice. Now, coming to our homeopathic and our master Henneman, in 239 FR says, as almost every medicine causes in its pure action a special peculiar fever. Every medicine, entire Materia Medica, every medicine has got and represents the peculiar fever and even a kind of intermittent fever with its alternating states, differing from all other fevers that are caused by other medicines. Homeopathic remedies may be found in the extensive domain of medicines for all the numerous varieties of natural intermittent fever, and for a great many of such fevers, even the moderate collection of medicines already proved on healthy individuals. So Dr. Henneman was very much open of that. We don't have one medicine, we have entire Materia Medica in our box, so that they can be utilized and they are widely used for use in the homeopathic system of medicine. So homeopathic guidelines and presented as presented and a specific guidelines for the case taking of acute diseases and understanding of fever based on 231 and 250. So these are the homeopathic aspects. Read thoroughly the case taking chapter from 83 to 104, and then also the guidelines for the acute case diseases and fever conditions from 230 to 31 to 250. The fever during pandemic and epidemics. After seeing the few patients, a genus epidemicus understanding, it brings out abstention to particular groups of medicines which are indicated frequently. Yet, as a normal, every individual are unique, we should keep ourselves vigilant for search of individuals beside the epidemic. Individuality is the ultimate guide for singular medicine, a medicine system. And Henneman's overall view, the totality of symptoms, which characterizes even given case being once committed to writing, the most difficult task is accomplished. The Henneman says, once you have collected the history, your task is over and you will get the medicine. Dunham says, to select a remedy after a masterly examination and record of the case is comparatively easy. But to take the case requires great knowledge of human nature and history of the disease. Make haste slow, don't be fast. Slowly you can win the race. Disease demands a close observation of instructions and strict adherence to the principle for successful treatment. And utility of fever in the Bonnie Gibson's therapeutic pocket books. Every author have given emphasis on the fever. And fever totality of the Bonnie Gibson is that not alphabetical in section 7. It includes the circulation of blood, cold state, coldness, heat, perspiration, compound fever, and concomitant. These are the chapters devoted to the in 7 sections about which are related to the fever. So this is the Bonnie Gibson's concept. Then Bonnie Gibson's characteristics by the BBCR by the CM Boger. The arrangement chapter on fever is self-explanatory. From the practical point of view, this chapter is of immense usage. It has many sub-rubrics also concomitant in relation to chill, heat, sweat, and the different headlines are really valuable at bedside. So the chill, heat, sweat, and different headings are required to be understood properly. Then BBCR, the element of the chapter it has many sub-rubrics. Okay. Now, each stages of the fever is followed by time, aggravations, ameliorations, and concomitant. We have to keep in mind. They help to reporterize and any simple as well as complicated case of the fever. They should be arranged properly in order to get stimulum with the help of Boger repertory. So this is Boger totality, fever totality. Then in the BBCR, that is Boger-Bonifacien's characteristic repertory, we have the chapter on fever, which includes the pathological types, blood, circulation, congestion, palpitation, time, heartbeat, pulse, time, and the aggravations. Then chill chapter is there, partial chill, coldness, partial coldness, fevering, time, and amelioration. Heat and fever general, partial heat, time, aggravations, ameliorations, and concomitant. Sweat is important associate concomitant for the fever. There is a partial sweat, time, aggravations, ameliorations, and concomitant. And there are the compound fever, which is very useful for the typhoid and many other cases. Beginning with the chill, beginning with the fever, the heat, and beginning with the sweat. So concomitant to be observed in all chapters. Now, what about Kent? Chapter fever from homeopathic repertory by James Taylor Kent. This repertory was originally published in 1899, and this chapter gives all symptoms related to fever in an alphabetical order along with their indicated remedy. And chapters chill from homeopathic repertory by James Taylor Kent is there. This repertory was so chill chapter and fever chapter. Two different chapters are there in the Kent repertory. Kent repertory includes, you will find the fever, and in the particular chapter also you will find the fever. And there is a dedicated chapter on the fever. And fever related rubrics are to be found all chapters, including the generalities and the mind. The pages of the fever that you can see in the fever chapter. So this fever chapter is from 1278 to 1292 pages. Fever, different type of the fever, these are there. Now, for the fever, we have to be very careful about the case taking. And case taking has to be divided there. Then you have to collect the symptoms. Then you have to make the physical examinations and explanations and planning and the closing sessions. And between this, it is also very important that you have to provide a rapport and relationship with the patient. So this outline is very important for the case. Now let us see how we can proceed on the case taking. It's still very longer, but it takes more than 4 to 5 minutes. And at least we must have some understanding. And you can minimize the effort. So that's why I'm giving you a small three perspectives. We have the three things that we have to think. The biomedical perspective, where you have to understand the symptoms, analysis, analyzing each symptoms and review each symptoms to localize the source. So this is biomedical perspective. Then context Positive is there, malaria parasite is positive is there. So all part of the body. So these four area are very important area: biomedical, contextual, and systematic review. Biomedical, presenting complaints of the fever, feeling hot, a feeling of the heat does not necessarily imply fever. Now, the patient will say, doctor, I am feeling hot, but when you take the temperature, you don't have the fever. So there is a febrile repertory or in the excitement feverish, rubric is there, excitement feverish. Then rigors, profound chills accompanied by chattering of the teeth severe can be produced by brucellosis. If the chill is there, there may be the malaria, there may be the sepsis conditions, there may be the lymphoma or excessive sweating. Night sweatings are the characteristic for the tuberculosis. But sweating may, from any causes, is usually worse at the night. So, feeling hot and feeling cold. Then recurrent fever is often a focus of bacterial infections such as cholecystitis or cholangitis or urinary tract infection with an obstruction of the calculus. Recurrent means repairing again and again because the infections are increasing and decreasing at the time. And headache is another important area where the fever usually provokes the and it is associated. So, and with the headache, what do we have? We have the photophobia or the sluggish meningitis. Then delirium. Mental confusion during fever is well described and relatively more common in young children and the old. Then muscle pain, myalgia is the characteristics of viral infections such as influenza, malaria, and brucellosis. Then the biomedical perspective, symptoms, analysis of very presence of fever, true or factious fever, it is true or not, duration, acute or chronic, mode of onset, how it appears, abruptly, suddenly, it continuous or intermittent. Ask about the fear to determine the pattern, severity, how it is affected, whether the patient is able to do his work or not. Then relieving and aggravating factors should be noted and treatment received. If it is a new case, no doesn't matter, but if it is coming from the other field, we have to note what medicines he has taken. Then associated symptoms, localizing symptoms may be indicated in the source of the fever. Suppose the fever is there, the patient will say, Doctor sir, I have a pain in my abdomen, I get the diarrhea. These are the associated symptoms, they become wonderful closeness with the medicines. Then with the biomedical perspective, respiratory tract symptoms are there, abdominal symptoms are there, rashes are there, hemorrhagic pain are there, constitutional symptoms are there. The weakness is very important, fatigue sensation is very important, anorexia is also very important like that, fever, chills, lump, and night sweats. So this is the biomedical relation to the biology of the human being. Then contextual fever, history, past history and surgical history is important. If any past history is there, if there is blood transfusion or blood grouping is there, then history of dental extraction, circumcision or any excessive bleeding during these procedures. Patient known to have rheumatic heart disease is at risk to develop infective endocarditis if not given prophylaxis. Any minor operations or procedure including endoscopy, interventions and biopsy. After the endoscopy, after some pathological test, patient used to come with some of the fever. Then history of trauma, accident, like that, and accident, where it has taken place, and what type of the accident was there, and history of the two people also very important. These are called the contextual history. Then drug and allergy history. We have to take the, if the patient is have a allergic to any of type of the drug, whether, and is there any blood transfusion was done or not, and immunizations against hepatitis A, B, typhoid, or any other immunizations was done or not. These are the contextual history we must have to take up in the mind. Family history is also important. The family disease running in the family, breast cancer, ISD, BMS, like this, running in family such as TB, leprosy, cholera, typhoid in the case of epidemic. This is very important. Okay. Then there are the social history, social like occupations, and educational background, family social support and financial situation, social classes, etc. And home environment is important. Sexual history, unprotected exposure to sexual partner with STI and HIV, and illicit drug usage, injections, and sharing of the needles, they all count. And if you have got this thing in mind, it is very easy, it becomes very easy to understand the medicine. And in the contextual history, you must know about the travel history also, whether the patient was away from the house or far away place, and where he has gone and for how long he has stayed. So you can find out some of the relevant from the how long you were there, did you have any insect bite, were you in contact with the animal, any prophylaxis against the malaria was done or not, whether you went to the endemic area. And so this area, now in the pandemic conditions, in the present corona COVID system also, we are giving so much importance on this, the area of travel history of the patient. Always ask the patient, is concerned, and it will constitute the totality of your system. You have to go on very cardiovascular, gastrointestinal system, respiratory system, urinary system, nervous system, visual, smells, taste, hearing. That all you have to see. Now, see, in the present COVID situation, taste has a very important marker for the present illness. So, then aches, fits, pain, loss of consciousness. So, totality of fever is scattered. It is not in one place. You have to get it from the different place. Not any, suppose you don't see anything and we release the fever, you will not be able to treat the fever. So when the fever symptoms come, if they come patient come, just don't with the fever and you can get symptoms associated has to be understood with it. So there are the causations, expressions, and the effects. These three things get combined to make a totality of the fever system. Simillimum comparison. Simillimum comes from the comparison. Selection of the remedy for a case of sickness is a process of comparison. So we look into the materia medica, we look into the repertory, and we see the. So we see in the drug symptoms and those of the patient. So how parallel are? The drug symptoms is in one row and the patient symptoms is in another. Simillimum. Then there are many things. Whenever a patient suffers from fever, the whole body is hot. There may be but heat are not equally distributed. Keep in mind, heat are not equally distributed. And If the whole body is heat, at some place you will find there are his legs are very cold. You may feel that nose is very cold. Some part of the body is very low, and this is very important for having fever situation. So these are the opposing the disease state. So during fever, two opposite behavior are observed. Nature of individual to oppose any things that come to him as hindrance in his normal and matter of ease. Thus, there are two uh, different situations are observed in every case. Example, during heat state, whole body of the physical body is hot. We can see some specific area to be the cold. So these are the opposing of the case. Cite some of the examples with some of our case patients and during the present COVID situation. This is a patient, the file number is there, name of the patient is, and it is 40 years male. He is our old patient. He was suffering from the hyper. He was taking some medicines for since long, and he suffered from the fever from 21st of the July 2020 and was reported to be COVID positive 19 after being detected the positive. Still preferred to take our medicine. This was the good sign. And why? Because there's the doctor. Our treatment is very simple. Only by telephone, he can be treated because his hair is with us. He can be so he preferred to get from our system. He has the faith with the family. So now observation in the chest, very for this present situation. Throat was painful, burning ever since the fever. Eyes were also burning. He was feeling weak. He was under our treatment. His constitution lean and thin. Anticipatory fear dominated and presently previously in the case and taking these rubrics, chest operations, for the heaviness, the rubric is operation, fever during aggravates. There are 55 medicines. Throat pain, heat during 20 medicines. Pain, fever during 39 medicines. Weakness, fever during. This is in the general complaints fever because he is a patient from chronic. So we took this rubric and elements from anticipation. This is very important for the patient because earlier also he was anticipatory patient and at present it is got aggravated. And his thought was concentrated on the disease, and because this is the constitutional symptoms I have taken in this case as a lean people. He was very lean and thin person. So now the three medicines was very common: arsenic, sulfur, and the CPR. I preferred that I should go with the sulfur because he was suffering from, he has taken some of the paracetamol also. So I considered using the sulfur at the first instance. So first prescription was sulfur by 5. Usually in the fever condition and acute condition, it will be better that you go beyond 3 to 0 by 3, 0, 5, 5, 7, etc. And asked to report after the 2 days. After that, he reported fever was the same. So we gave the stroke. Then again on 24th, he reported that fever, chest degree still. So we didn't change the medicine. Then fever was gradually down and things were also getting better. So we didn't change any medicine. And then again on 28th, he reported 99 only from 1 to even the 2 to 3 p.m. So we didn't change the medicine. Then No fever was there, and then he started feeling gas sensation in the chest from 31st of the. So, he was just was done at this moment. COVID-19 was positive. Eruptions reappeared. So we gave the stroke. So fever was 99. Now we thought of eliminating some of the situations from him, and we NV055. And on 16th of August, it was reported that now he is. So no fever, only eruptions persisted. 28th August, eruption persisted. He stopped the medicine. He is still under the treatment because he is our old patient and his chronicity. So this is a chronic patient getting fever in between. This is a concept. His other family members were also became positive. His son was positive. His wife was positive. They were also treated, and they became cured within 2 to 3 days. But this patient, he took a longer time because he was suffering from some of the chronic illness earlier. But now he is free from the COVID-19. Now he is also our old. He is suffering from the stricture urethra, and he is under our treatment since 29th May. At the time there was no fever, and was receiving our constitutional treatment, and last medicine prescribed was the syphilinum. He was transmitted syphilinum. This was the last medicine that we have given to him. He developed fever on November 20. The taste of the mouth got no taste for the food in the mouth. He became panicky with the fever in the present situation. So he reported to us, he asked us what to do. So what we observed, he developed cough along with the he was feeling weak, and he was our treatment for the structure urethra. He was feeling cold and thirst for a small quantity. He was worried about the life. Now, with these symptoms, we report insipid food. This is rubrics there. Very common rubrics for the present situation for COVID, where the food taste become tasteless. So you can utilize, and there are only 19 medicines are there. So it is thirst for small quantities of water, fever during, accompanied by coryza, fever, chilliness with throat pain, burning, and anxiety helps about his, and this the only medicine that covered the whole scenario, arsenic. And definitely this case was the representative arsenicum, and after the syphilinum, I think this to be the suitable medicines for it. So we on 12th of the September, he was transmitted with the 0/5 in arsenic, and he reported to report. On 15th, he reported no fever since 12. Ever since we transmitted arsenic, the same day down, and he is free from fever, but he is still. We have gone back to the syphilinum. We shall be continuing with the fever arsenicum for till the another situations comes up. So this is a very important case that I have seen during this. And likewise, so many cases we have discussed, we have taken up, and it is. I see that it is one of the simplest way to practice and cure the medicine patients with homeopathic understandings. Now, there another case I am going to tell you about the cardiac, old patient of the cardiac complaints in our country. And he suffered from the fever from 25th July and was reported to be having fever 99 degrees. We didn't change the earlier medicines, only gave a stroke to the previous medicine, vomica. He was on the treatment for the some of the heart problem, and he was transmitted with the nux vomica. So what we did, we didn't change the medicines, we simply give the stroke to the transmitted 5. Then she again reported that no change is there, so we again gave the stroke, and by the evening the fever went up to 102. Now what happened? We reviewed the present situation. Mouth was dry with thirst for the small quantity. Eye was also burning. She was feeling weak. She was under our treatment for chronic illness, and her constitution was lean and thin. Anticipatory fear dominated all the time, and presently the mind was around the fever. So we took the following rubrics: mouth dryness, fever during mouth dry. See where we are getting the fever rubrics from: the mouth, eye, stomach, all these area where you can get the, and everywhere you will find the fever. Mouth dryness, thirst with mouth, mind restless, heat during eye pain, fever during eye pain, burning, and general lean people, anticipation, and then thirst, small quantities of water. So we have the lyco, arsenic, and the veratrum. Lyco, arsenic, and the veratrum. We preferred, as Nux vomica was earlier, we had already transmitted, but when the fever went up, we transmitted the arsenic 0/5. And 28th July and then 31st July, no change was there. We didn't change the medicines, but the patient was feeling better. And on 8th of August, chest pain and cough was there, and which was aggravated in the morning. We give the stroke. And 14th August, the stool hard with pain in the rectum and back, again a stroke. And 16th of August, there was no fever, no change in the medicine. And 28th August, stool better and no fever, no change in the medicine. And now she is free from fever, and treatment continued for her chronic illness. So this is another case that we got cured with the arsenic. Now another very few days back, she is the wife of our OPD patient, developed fever after religious fasting. Jitya was there in our festival is there. So on 9th of September, she fasted, and fever came on the 11th of the September. She was not under our treatment, new case, but husband had faith on our. So he telephoned for help on 13th September 20. We took the history on the mobile itself. She was a typical housewife. I didn't saw her face still date. She was feeling fearful as she felt that death is very much approaching. The dying sensation was there. She was restless with the fever and had consumed paracetamol twice. Every time fever subsided and relapsed. Whenever so she took the paracetamol, it come down and went up. Mouth test was bitter. She was feeling weak. She was having no thirst at all. She had pain in the extremity. Fever was started only after the fasting. So after and presently mind was revolving around the disease. Now we took the following rubrics: death presentiment of that I am going to die, and sensation of dying. These two mental rubrics was very prominent in this case. And bitter taste was there during the fever, thirstless, then fever, extremities pain, fever during fasting aggravate, and general pain, body all over. So we get the sepia and the aconite. I preferred sepia. Why? Sepia because she has consumed some of the allopathic medicines like paracetamol, and whenever some patient comes complicated, has taken some of the medicines, it is better to start the treatment with sepia as in chapter and the report. When the case is confused, so many medications, even by if you have given homeopathic medicine one after another, and the patient coming, the sepia will be useful as well. We did this transmission because here not with us. So we asked our colleague to get the sepia from the local market, So he brought CPR 200 and 2 drops to be taken orally 3 times a day. Since sorry, this 13th, this is 24, no, it is 14th. 14th September, no fever. The very next day, first dose of the CPR was given in the night, and second day morning, she took the CPR and no fever, and she continued taking the rest of the day. Now we have asked to stop her. This morning also, I had a talk with the family member. He was happy. He was well to doing her house as if nothing had happened to her. So these are the aspects that you can see, and I try to demonstrate, to give you the example. But these are very simple. You can do it in your clinic. We should recognize that as a whether fever is beneficial or not is still a controversial, and more effort should be exerted to determine the function in every febrile disease. As a clinician, we need to educate our patients and other health professionals about the fact, and the antipyretic should be used sparingly in our clinical practice. So it is often when night looks darkest, it is often before the fever breaks that one, since the gathering momentum of changes, when one feels that resurrection of hope in the midst of the despair and apathy. So there is nothing to disappear. There are always the rays of hope. So Hillary Clinton message is very important for all of us, that there is nothing darkness. If you have the patience, if you have some rays of the hope in your mind, still with the rays of hope only, you can win the race. So humanity has but 3 greatest enemies, as I told you earlier also. The fever, famine, and war of themselves are the greatest. By far is the most terrible is the fever. So friends, fever is terrible, but fever is not so much terrible for a homeopathic physician. And you don't have to worry, because your Materia Medica is the vast, and as Henneman told, every man find out. I have given you a vivid scenario from where to search and how to search. Just start and begin, and you can get the medicines very. So with this thing, I thank you very much. And if you have any questions, you can write to me on ID @the and give me a WhatsApp message or Telegram on 9431020622, or you can contact Dr. Anand. His mobile number is also there. So keep meeting us, keep reading, keep learning, and this is my message for all of you. Because learning is the only process that can help you to, because medical education, it never ends in a day. It never goes down. You have to be with the medicines for every time. You have to be with the medicines. You have to be with the books. You have to be with everything for every time. So thank you very much for this, my present learning, understanding. And if you have any, we can, I'm just this lecture is over now.